We're live.
All right. Hi, everyone. Today we're going to talk a little bit about health policy. We're going to talk about what it is, why it matters to nurses, and how one major policy has shaped healthcare over the past 25 years. So let's start. What exactly is health policy? Basically, it's a set of laws, rules, and decisions that guide how healthcare is delivered and funded. It affects everything from how hospitals are staffed to what kind of care patients can access to even how nurses do their jobs each day. For nurses, health policy isn't just something that happens in Washington, it's something that impacts our daily practice. Policies can influence staffing ratios, safety standards, reimbursement rates, and even how much time we get to spend with our patients. So, understanding health policy helps us advocate for safer workplaces and better patient outcomes. In other words, when nurses understand policy, we can have stronger voices for change. One great example of a policy that's had a huge impact is the Affordable Care Act, also known as the ACA. This was passed in 2010. The ACA expanded health insurance coverage to millions of people who didn't have it before. It encouraged preventative care and tried to make healthcare more affordable overall. For nurses, this meant seeing more patients who finally had access to care, and it opened up new roles, like in care coordination and in community health, where nurses help patients navigate some really complex systems. Research has shown that the ACA helped reduce hospital readmissions and improve preventative care use, showing how policy really can lead to better health outcomes. So, to wrap up, health policy shapes what we do, it shapes how we do it, and who we can reach. As nurses, we're not just care providers, we're also advocates for our patients. And the more we understand about policy, the more we can help shape the future of healthcare. All right. So, who do we have up next?
It's me. Hello. So, current health policy impacts, right? Nurses have a responsibility when it comes to implementing and evaluating current health policies. Many policies are developed using evidence-based practices. So, when nurses understand these policies, they're able to provide consistency and quality when it comes to patient care. However, not every policy works as intended. So, we have to really evaluate, is this helping provide the best care to the patient? Is it improving efficiency, effectiveness, and all sorts, right? It's important to bring these concerns that we have of ineffective policies to the appropriate supervisors, but know that nurses don't just decide, hey, I'm not going to follow this policy because I don't want to. I got some examples here of health policies and how they influence healthcare practices and patient outcomes. Uh, on a statewide level, right, we've got the Workplace Violence Protection Act that helps to keep nurses safe on the unit. When nurses are safe to provide care, they are able to provide better care. I've also seen hospital-wise policies that can impact patient health, patient outcomes as well. During COVID, I witnessed a mask being placed on vented patients. Right, and ventilators are closed systems, so this was really unnecessary. It produced a lot of waste, but it also made these nurses really frustrated from not understanding why are we doing this. Right, if we have to put masks on people who we're transporting, why are we wasting masks for these ventilated patients? And I noticed that it did lead to increased burnout and frustration, which impacts patient care. Additionally, their outcomes as well. Secondly, with two independent nurse checks for certain medications, Westbrook et al. Shows that allowing that increased accuracy in medication administration resulted in reduced medication errors from these independent checks. However, when nurses prompt other nurses and say, "Will you sign off on this? It's whatever it is," and they say, "Sure, I'm just going to sign it." This actually has no additional benefits to just one nurse checks. So it's really important that we follow these policies and procedures as they're intended to be, so that we can keep patients as safe as possible on and off the unit. Thank you.
All right, I believe I'm next. So for my sections, I will talk about nursing advocacy and health policy and how nurses use their frontline experience to shape safer, more equitable care. Nurse often the first to see when a policy is not working for patients. At bedside, we see delayed care, safety risk, and barriers that family faces when they try to navigate the system. Because of that, nurses are in a unique position to bring real stories, quality data, and clinical outcomes to the policy table. We advocate through many channels such as base council, shared governance, hospital committees, and professionals organizations. And an example, which are American Nurse Associations and specialty societies. In those spaces, nurses review evidence, get feedback on proposed policy, and push for changes that support safe staffing, as well as access to service and high quality care. We also educate patients and community about how policy decisions affect their health and encourage them to speak up alongside us. There are many examples of nursing advocacy changing policy, but I will highlight two that is very notable. The first is the Needle Stick Safety and Prevention Act. Bedside nurse documented frequent needle stick injuries and the fear of contracting HIV and hepatitis. Working through nursing organizations, they collect data, met with lawmakers and demanders safer devices. The advocacy led to a federal law that requires safety engineer needle staff input when choosing devices and tracking sharp injuries, which has ultimately reduced injuries and improved safety for both patients and staff. Another notable example is a California nurse to patient staffing ratio known as AP 394. Nurses spend years testifying and presenting research showing that unsafe workload were harming patients and burning out staff. Their effort led to, first state law with minimum RN to patients ratio, such as one nurse to two patients in intensive care. Research has shown that these ratios are often associated with lower mortality rate, better outcome, and less burnout, demonstrating how sustainable nursing advocacy can shape policy that protect both patients and the workforce. That's how nursing advocacy and health policy move from bedside concern to real measurable change.
I'm next on this one. So I'm gonna talk about the two health policy challenges in the United States right now and how they affect nursing and even patient care. The first one will be the ACA, and the second one will be the reproductive health. So for the first one, when it comes to the ACA, the last shutdown we just had was one of the key issue, right? So after 225, the ACA, the big problem is how the extra help that made the Obamacare insurance cheaper is ending. And during the last few years, many people got more financial help to pay for their monthly premiums, right? So when this help stops, the payment's gonna go up, and many people are not gonna be able to afford insurance anymore. Others will, sorry, will go on to buy cheaper plans that do not cover much. And now the big issue we got is that there's fights in Congress where politicians argue about how to spend federal money, and sometimes they keep using the health coverage as a bargaining chip during these shutdown talks. So people's healthcare became part of the political games. Now, for nursing and patient care, this has real effects. People lose insurance or has they have bad coverage. They avoid doctors until they are sick. When they see them in the ER, we advanced diseases and even many complications. The ER first becomes crowded. The nurses have heavier workloads, and even which contributes to more burnout. And plus, also when we discharge patients, we give them prescriptions, follow-up appointments. But if they really can't afford the medicine or visits, the treatment plan fails. So this is cause sometimes the more distress for the nurses because we know what care the patients they need, but the system and even the costs stop them from getting it. Let's go on the next one. All right. And when on the second problem, on the reproductive health, the safety nets and even mortalities. So after the Dobbs decision, when it comes to the Supreme Court, when they removed those challenges a while back, and they left the decision to states, right? Many states they made strong limits on abortion, right? And we still live in a country with no paid maternity leave, and we have one of the highest maternity death rates among the richest countries, right? And in other high income countries, women get paid time off after birth. Like countries like Canada, you can get like a year and a half. Portugal, same thing. You know, people have strong health coverage and even better social support. While in the US, many women lose coverage after delivery. Childcare is really expensive, and mental health is hard to access. So we have women forced to continue pregnancies, but less support to keep them safe. On the side of nursing and patient care, this means high-risk pregnancies and preventable problems like preeclampsia, hemorrhage infections, and even severe mental health issues. In some states, care is delayed because doctors and hospitals are afraid of legal trouble when pregnancy care might end the pregnancy. And most times, us nurses are always going to be in the middle, watching the patient get worse while the team waits to what constitutes the threshold for what's legal, right? We also see more women coming to the ER after birth with blood pressure problems, heavy bleeding, depression, and even anxiety. This keeps increasing the workload and even the emotional stress on nurses, right? And when nurses feel that it always issue, and then we push to speak up, we gotta become like the advocates, right? For safe maternal care, for the paid leave, better social and even mental health support for the mothers, right? So, in summary, both of these policy problems show that decisions made at the national level directly shape what we see at the bedside. They affect who can get care when they come to us and how sick they are. And as nurses, we are not only caregivers, but we also witness and sometimes advocates in this whole advocacy policy debates. Thank you.
So now knowing what we know, knowing a little more about what policies are, and how those can affect either the health of our patients or us in workflow spaces at work. Now we would like to be involved in policy change as nurses because those things affect how we work and how our patients' outcomes tend to be. So what data shows is that working with teams broadens the scope and credibility of advocacy initiatives. So physicians providing clinical outcomes data, social workers highlighting social determinants of health needs, and public health specialists assessing implications within the population can help us know more about what we need and how we would be able to find solutions. So when professionals work together, we build a unified interdisciplinary statement. It carries greater weight with all the varied professions putting their input, therefore knowing what we want and being able to advocate for that. Collaboration like this ensures proposed policies address the complexities of what's going on, and it makes sure that every component is there for every area of health. Along with including everyone and being able to know what each part a policy can address. Where we can have support is having professional organizations like the American Nursing Association, the National Association for Hispanic Nurses. Associations like this play critical roles in amplifying our voices, so they can use their expertise and their knowledge within all of our community to be able to offer position statements and create events that can make participation more accessible for us. And then having our opinion and our input can make those policy recommendations a little more credible.
Okay, so I have some practical tips for engaging in advocacy on the local level, national level, and global level. So, at the local level, nurses can advocate by collaborating with interdisciplinary teams such as physicians, social workers, pharmacists, and administrators to identify policy-related issues that impact patient care and the work environment. Participating in committees like shared governance or hospital quality and safety committees allows nurses to directly influence organizational policy decisions and ensure that nurses' perspectives are represented. Nurses should also remain informed about internal policies and speak up when procedures or standards need to be updated or clarified for patient safety and workflow efficiency. On the national level, engaging with professional organizations such as the American Nurses Association or specialty nursing associations help nurses stay informed about changes in federal health policy and regulatory standards. These organizations also amplify the collective voice of nurses. Nurses can participate in the national policy advocacy efforts, such as responding to legislative alerts, joining policy campaigns, or contacting elected officials about issues affecting practice, staffing, or patient safety. Attending conferences or virtual policy webinars helps nurses stay updated on current legislative trends and understand how national policies trickle down to influence local practice. Globally, nurses can engage with international networks like the International Council of Nurses to gain exposure to worldwide health policy issues and best practices. Nurses may also take part in global health initiatives or policy discussions that address challenges such as disease outbreaks, workforce shortages, or international nursing standards. Drawing on global trends helps nurses understand how policy decisions in one area impact health systems elsewhere, and this global perspective can strengthen local and national advocacy efforts.
Here are references. Thank you.